Welcome to What You Want to Know About Spinal Cord Injuries, where I answer the most common questions you have about spinal cord injuries. Today, we'll be talking about bladder and bowel function after a spinal cord injury. A spinal cord injury is so much more than just the inability to walk. After my injury, when I was in ICU, I remember the neurosurgeon coming in and telling me that I would never walk again. As a 16-year-old girl, I just wanted to tell him, I know, I told you that. I had told my friends not to move me because I had broken my neck. What I didn't realize was the impact a spinal cord injury has on all areas of our life. Of all of the losses that come with a spinal cord injury, bladder and bowel function probably affects our lives the most. If you talk to 9 out of 10 people with a spinal cord injury, I can guarantee you they would prefer to have bladder and bowel function over the ability to walk. I know that's a pretty bold statement, but that's how much bladder and bowel function affects our daily lives. Before we move into the topic today, which is bladder and bowel care or management, I want to mention that this topic is not always the easiest to talk about, especially immediately right after an injury. I know for me, it was mortifying to talk about this. Yes, I know, everyone pees and poops, but not everyone talks about peeing and pooping. So if you're going into the medical profession, please remember this. When I was in rehab, I had a doctor come in. He was looking down at a file. He was filling in for my regular doctor. And he starts talking about my bladder leaking. He didn't take the time to see who else was in the room. What he didn't notice was that I had 3 guy friends sitting in the room with me. And as a 16-year-old girl, I was horrified. So medical professionals and even friends and family, tread lightly as you start introducing this topic. Obviously, over time, I've gotten over the fear of talking about bladder and bowel issues, but that's not going to be the case for everyone. So let's talk about the ways in which someone with a spinal cord injury can manage their bladder after a spinal cord injury. There's a number of different ways, and these include intermittent catheterization, a Foley catheter, a suprapubic catheter, a condom catheter, and the Mitrofanoff procedure. And with bladder function, or bladder care, I should say, it's going to differ a bit between males and females simply because the anatomy is different. But for the majority, these are the main types of ways in which we can manage bladder care. So let's start with intermittent catheterization. Intermittent catheterization involves catheterizing every 4 to 6 hours with a catheter. A catheter is simply a tube that is inserted into the urethra and allows the bladder to be emptied. The goal during the first couple weeks or months after a spinal cord injury is to have the bladder hold around 500 cc's of urine, in my experience. So intermittent catheterization is the first option. This is actually what I started with in rehab. But as a female quad, it was really a big hassle. Every time I would have to cath, I would have to be transferred into bed, get undressed, or be undressed because I couldn't do any of this by myself at the time. A nurse would catheterize me, then I'd have to get redressed and back in the chair. And as a 16-year-old girl who wanted to go back to school and go to college, it just wasn't going to be very conducive to living life. And I met someone else who was a female quad, and she told me about a Foley catheter. And that's when I switched to a Foley. A Foley catheter looks very similar to a catheter that you would use for intermittent catheterization. The difference is that it has a balloon on the end, and you put about 5 to 10 cc's of saline in that balloon once it's in the bladder, and it anchors it into the bladder. At the end of the catheter, you can attach a bag, and the urine just drains consistently throughout the day into the bag. And this ended up being a really great solution for me for the first 17 years of my injury. I just had a small bag attached during the day to the catheter, and I was able to put it inside my underwear at my hip. No one even knew it was there. I learned how to get it in and out and was able to empty the bag by myself. And so it ended up being a really great option for me. There is a higher risk of urinary tract infections with Foley's, so it's not always the first option that doctors or medical professionals would like to go with. But for me, it was a great solution. The next option is the suprapubic catheter. And this is similar to a Foley in that it is inserted into the bladder, but instead of going through the urethra, a medical doctor will actually insert the catheter into the bladder through the abdomen. And just like a Foley catheter does need to be replaced every 4 weeks. So does a suprapubic catheter. But the Foley and the suprapubic are similar in that way that they are going directly into the bladder and drain the urine in that capacity. It stays in. So that's one other option. For males, there's the option of a condom catheter or an external catheter. So it's placed on the penis just like a condom would be. A catheter is attached to it, and that is attached to a bag. There's nothing similar to this for females, unfortunately. So males have that option as well. One of the other common ways of managing bladder after a spinal cord injury is called the Mitrofanoff procedure. And I found out about this about 17 years after my injury when I started having problems with the Foley catheter. And the Mitrofanoff procedure takes a small section of bowel tissue or the appendix, and it makes a stoma. And a stoma is just a small hole in the abdomen that leads to the bladder. And through that stoma, which is continent, so it means that it won't leak, you can insert a catheter. So as a female quad, and with the female anatomy, it's very difficult for females to find where to aim. But with the Mitrofanoff procedure, you can see the stoma, and it's really easy to get a catheter in. It's easy access. And so for me, because I had had a Foley catheter for so long, my bladder had shrunk. Your bladder is a muscle like anything else, and mine never had the opportunity to expand because the urine was consistently draining out into the bag. So I also had to have a secondary procedure called a bladder augmentation. And that simply takes a section of bowel tissue and creates a larger bladder. And so between the Mitrofanoff and the bladder augmentation, I can easily hold 500 cc's of urine and catheterize on my own. So these are the 5 probably most common ways of managing the bladder after a spinal cord injury. There are a few others, but once again, these are the most common. There are several complications that come along with bladder management. And one of these is, it's called a neurogenic bladder when you have a spinal cord injury. So I just kind of say the bladder can get angry, and that's when the bladder spasms and you can leak urine. There are oral medications that can be taken to help prevent leaking, and there's also more and more people are using Botox in the bladder as a way to prevent the bladder spasticity. That's one complication. The second complication is urinary tract infections. Because we're consistently putting a foreign object into our body, there's a higher risk of developing an infection. The really important point to know about UTIs and spinal cord injuries, as well as the general population, is that you really need to get a culture if you think you have a urinary tract infection. And that's because we're over-treating UTIs to the point that there's so many resistant bacteria that oral medications are no longer working. So if you feel like you might have a UTI, I always go to my urologist and give them a sample. They do a culture, not a urinalysis, but a culture and sensitivity. And what this does, it takes about 3 days to grow some bacteria. And then that sensitivity report will tell you what antibiotic you need to take in order to kill the bacteria that's in your bladder. The other important thing is if you're not symptomatic, don't take an antibiotic. And there might be a few exceptions. But for the most part, if you're not feeling crappy, if you don't have a fever, then just let it be. Because what's going to happen whenever you get a culture or a urinalysis, it's going to come back positive. It's called colonization. And so someone with a spinal cord injury or someone that catheterizes on a regular basis will be colonized, which simply means there's going to be bacteria in the bladder constantly. And so if you're not symptomatic, don't treat the UTI. So those are a couple ways of managing the bladder with a spinal cord injury, as well as a couple of the complications that come along with bladder management. So let's talk about bowels. Well, let me just tell you, it's a really crappy situation. The goal of the bowel program after a spinal cord injury is to really just have the bowels go on command. And the way of doing this is beginning a bowel program. A bowel program consists of regularly using a suppository. Typically people will use a suppository. And what the suppository does is it kind of irritates the inside of the bowels and it creates peristalsis. So the poop is going to start moving down the bowel into the rectum. And then hopefully it will empty. But that's not always the case. And many people with spinal cord injuries have to add a second layer into this process. And this is called digital stimulation. And yes, it's as miserable as it sounds. So digital stimulation, or what we usually just call it DigStim, involves taking a gloved, lubricated finger and inserting it into the rectum and making a circle. And what that circle does, it relaxes the anal sphincter. Not only does it stimulate the bowel a bit more, but it also relaxes that anal sphincter so that the poop can exit the body. So that's what a bowel program is. It's going to differ from person to person how often that's done. Some people do it daily, and you can choose to do it either in the morning or at night. And some people do it every other day or maybe even every third day. Every person is different, just like every able-bodied person is different. The bowel program can be done sitting on the toilet, on a bedside commode, or even in bed if someone's blood pressure won't allow them, or maybe skin integrity won't allow them to sit up during the bowel program. So they're all options. When I was in rehab and shortly after rehab, I had been taught to do my bowel program every other day. And my mom had to help me with this. So once again, just miserable situation with having my mom have to help me do this. But what I soon realized is that an every other day schedule meant that that was going to fall on a Friday or a Saturday night. And as a girl in high school, I didn't want to have to skip out on a basketball game or a party at a friend's. And so I decided to do my bowel program on Tuesday, Thursday, and Sunday evenings or Sunday nights right before bed. And this allowed me to have a set schedule where I had Friday and Saturday nights open. And I kept this schedule for years, and it worked fairly well for me. It's one of the things with a spinal cord injury is that our lives often revolve around other things, and this includes bladder and bowel care. Another option for people with spinal cord injuries is a colostomy. And this is a surgical procedure where the part of the colon is actually attached to the outside of the skin, and a bag is placed over that stoma so that the poop can come out of the stoma and go into the bag. Why would someone go to an extreme? Well, it's because we can have accidents with the bowel program. Things don't always go perfectly, and you can get out of the house, away from home, and suddenly your stomach becomes angry and you have a mess on your hands. And so taking that away, out of the equation, can be a big freedom and just one less thing to have to worry about with a spinal cord injury. I realize that I didn't mention how I do my bowel program now. It's not very common, and that's why I didn't mention it, but I have a continent ostomy. So if you want to learn more about that, head on over to the video called BCIR for spinal cord injuries, and I'll put the link in the description notes below. I hope you've learned a few things about bladder and bowel care when it comes to spinal cord injuries today. Hit the subscribe button if you want to find out when new content is posted. And if you have a question about spinal cord injuries, comment below so I can know what you want to know about spinal cord injuries. Until next time.